Thanks for taking a bit of time to have a look at my book, Scary Diagnosis. My book focuses on what to do and what not to do if you find yourself or a friend or family member heading for or having already received a scary diagnosis. A scary diagnosis really of any kind. It's written from the perspective of both a patient. In my case, I was diagnosed with MS a little more than 4 years ago, and also from the perspective of a friend or loved one. My wife has had cancer twice. The first time was cervical cancer, which resulted in a hysterectomy, and the second time was malignant melanoma. Once I recovered from the shock and awe of my diagnosis, I began to question, why me? Why did I get sick? I had been a relatively healthy person all my life. And I think most people live in the fantasy world that I did. And that world included a picture of, gee, if I got sick, I'd be smart enough, I'd be willing enough, I could put together enough money to go where I had to go and do what I had to do to find somebody that would fix me. The reality is we know way less about illness and health than you might think. Many initial diagnoses are incorrect. Some put the number at above 50%. We also live in a world where many doctors practice in fear. There's a question of litigation if they're wrong. There's also tremendous pressure from the professional organizations that they belong to. And last but not least, of course, there's a tremendous amount of pressure from the pharmaceutical companies that provide many of the medications. I'd like to make it clear that I am not anti-pharmaceutical, and I'm certainly not in any way anti-mainstream doctor, although my book does talk about how to integrate alternative therapies in with some of the mainstream things that you can and should be doing if you find yourself confronted with a serious illness. It's really imperative that you hit the ground running. And so I'd like to just read through a couple of the chapters in my table of contents to give you a general idea of some of the things that I cover. The first couple of chapters are really the story part. What happened to me, how it happened to me, and how I was feeling during those initial days when I really was passive and I really was intimidated by what not only was happening to me, but by the people that I was seeing looking for help. So once we get through that, there's a lot of navigating that we do. Navigating the diagnostic process, navigating personal issues, navigating the healthcare process, navigating the internet for answers. A real goal of the book is to impress upon you that things change, and things change very rapidly. And we live in a time when there's tremendous access to information. And so you can't be afraid of the internet, even though sometimes what you find on the internet with respect to illness, particularly your symptoms, might scare you. You have to remember that often what makes top of the list on the internet are worst case scenarios. Then I talk about new perspectives on wellness, because I really believe that the immune system is the key. And I believe that we've really focused our efforts as a society on the wrong things. We've been very reactive rather than proactive. Chapter 9 is a very important chapter. It's the LDN story. I don't take any of the conventional drugs for MS, and that was by decision. After research and consideration and discussion, I decided to really try to deal with my illness through a combination of supplementation, which includes vitamins and minerals, did some chelation therapy because I tested very high for mercury, and also this drug called low-dose naltrexone. It's a drug that was not recommended to me by any of the doctors that I was seeing. I came across it on the internet by visiting user groups that were discussing MS-related issues and autoimmune-related issues. And I kept seeing these three letters popping up, and nobody that I had seen professionally had mentioned this stuff. Yet there were tens of thousands of patients that were reporting excellent results with low-dose naltrexone for a variety of autoimmune diseases and even some cancers, and certainly with MS. I tell that story in depth, but I think it's particularly important to mention it because it's a symbol that sometimes there are things out there that people are using and using quite successfully that you're not being told about. You're not being told the whole story. And it really is up to you as the patient or the caregiver for a friend or loved one who's incapable of doing the research and making the decisions themselves to look into what's available out there today. There's a long history in medicine of things being available and known for a long period of time and not becoming standard of care. Of course, the issue of stem cell research has been politicized, and it's an area that needs to be focused on and given serious attention as soon as we possibly can. The next chapter talks about dentistry. It's one of the longest chapters in my book, and I was shocked when I started reading and doing research to see that there was enough literature out there that indicated that dental practices, modern dental practices, may be great for your teeth. They may not be great for your teeth, but they may be great for your teeth. But what about the rest of your body? Using mercury in amalgam fillings, well, mercury is one of the most toxic substances on the periodic table. Using fluoride, again, a very toxic substance. Then there's all the plastics and solvents and other things that are part of dentistry today. I think it's really important when people are ill that they take a look back and they begin basically at square one with respect to what they choose to do and when they choose to do it. By that I mean, with many illnesses today, doctors seem to go from 0 to 100 without trying some of the, without suggesting some of the, without talking about some of the basic things that we probably should have been doing all along. You've heard all this before, and I don't attempt to be a specialist on nutrition or any of these general lifestyle related issues. What I do suggest is that you educate yourself and you continue to educate yourself so that you can make informed decisions about what you choose to do and what you choose not to do. And that goes for not only food and exercise and sleep, but it also goes for your choice of therapy and medication. And ultimately, I think most of you know that you're responsible for the choices that you make. Your doctors make suggestions, but it's often incumbent on you to make sure that you understand what you're taking or what's being done to you. And I finished the book talking about a new you and a new me, and part of that really is the whole mind-body connection and the importance of the physical and, yes, even the spiritual and emotional impact that those areas of our lives can have on our physical health. I made an extra effort to minimize medical speak and to present the information that I came across in a easy to understand conversational manner. I'd like to encourage you to spend a little bit of time looking at my website. It gives you a better idea of what my book is all about. You can also check it out on Amazon.com. There's a search inside feature where you can have a look inside and get an idea of what I wrote about and why I wrote about it and how I wrote about it. There are also some helpful links, and I would absolutely encourage you to follow the links with respect to LDN, especially if you have any autoimmune diseases, but certainly if you have cancer. And I'd also encourage you to feel free to send me an email with any questions or comments on anything I've had to say, this little bit of a video, and certainly on my book. My website is scarydiagnosis.com, and you can reach me at alan@scarydiagnosis.com. Thanks for spending the time, and I really hope that you find what I've had to say helpful and hopeful, and I really wish you your best possible outcome with whatever kind of illness, disease, or health challenge you happen to be facing. Thanks. Bye-bye.